Drugs are tested on unwitting human guinea pigs. A study conducted by Johns Hopkins University and published in the Journal of Medical Ethics asked hundreds of health researchers in developing countries whether their studies on humans were supervised by ethics committees. The resulting picture is depressing. 44% of respondents said no one oversees their use of human guinea pigs. U.S. corporations and nonprofits fund 1/3 of these uncontrolled experiments. As for the studies that were subjected to some sort of oversight, in 92% of cases the screening had been conducted by the ethics committees of the institution performing the experimentation, with no intervention from higher-level bodies. The study then revealed another fundamental problem: cases in which patient consent forms were not written in the language of the host country. Not that all researchers care about consent forms. In recent years, India has been troubled by the revelation of several illegal drug trials with fatal outcomes. Some of the country's largest pharmaceutical and biotech companies are up to their necks in scandals involving elderly people, infertile women, and cancer patients who were given investigational drugs without their knowledge. In the case of cancer, the secret trials were carried out by a Johns Hopkins researcher. But experiments reminiscent of Mengel's medical ethics are not only taking place in developing countries. Pediatric drug trials on U.S. orphans have almost completely escaped public notice, but independent investigative journalist Liam Sheff is lifting the lid on this dreadful practice. Given their utter helplessness, orphans have always been favorite guinea pigs of medical experimentation. The ICCA Catholic charitable organization under the auspices of the Archdiocese of New York houses children who are HIV positive or born to mothers with HIV. These babies have been used as guinea pigs for dozens of experiments funded by government agencies and pharmaceutical companies. They have been given highly toxic drugs, such as AZT, sometimes while they were still in the cradle. Although some of the parties involved claim that the children were able to enjoy wonderful state-of-the-art treatments, documents obtained by the Observer in London show that some experiments were aimed at testing the safety and tolerability, as well as the toxicity, of HIV drugs and the tolerability and safety of herpes drugs. The Observer reports that an experiment sponsored by Glaxo and the U.S. pharmaceutical company Pfizer studied the long-term safety of antibacterial drugs on babies as young as 3 months old. One study is headlined, Safety and Efficacy of Treatment of Patients' Effects from Advanced ADS, aged 4 to 122 years, with 7 drugs, some dosage higher than usual. Children who refuse to take medication have had a hole drilled in their abdomen through which it can be introduced directly into their system.